Do you or any of your loved ones suffer from stroke or any brain-related problems? Well, sit back, relax, learn, heal, and recover. A stroke can cause weakness or paralysis on one side of your body and problems with movement and carrying out everyday activities. In this video, I'll walk you through on how physiotherapy can help with stroke-related challenges, what it involves, and how to access it. If you have brain problems like stroke, Parkinson's disease, or any neurological disorders, this video is for you and your family. I'm your host, Chinedu Ubai, your favorite online physiotherapist, all fostering a community of knowledge and support. Stroke, what is it? A stroke occurs when a blood vessel in your brain ruptures, bursts, and bleeds, or when there's a blockage in the blood supply to your brain. Okay? The rupture or blockage prevents blood and oxygen from reaching your brain's tissue. So as a physiotherapist, my focus for my patients after stroke is to help them regain lost motor function and independence through targeted intervention and techniques such as balance training, strength building, walking, and mobility exercises to help with tasks like sitting, standing, grooming oneself, and walking after brain damage. Types of strokes. Understanding the different types of strokes is essential for accurate diagnosis and effective treatment. 1. Ischemic stroke, most common, caused by a blood clot or blocked artery. This type of stroke prevents oxygen-rich blood from reaching your brain. Okay? Risk factors include high cholesterol, hypertension, diabetes, and others. 2. Hemorrhagic stroke occurs when a weakened blood vessel ruptures, that is bursts, leading to bleeding in or around your brain. Common causes include high blood pressure, aneurysms, or trauma. 3. Transient ischemic attack, mini stroke, a temporary blockage of blood flow to the brain, although symptoms resolve quickly within 24 hours. A TIA or transient ischemic attack is a warning sign for future major strokes. Okay? Recognizing stroke symptoms. The stroke symptoms can be easily remembered by using the FAST test. That is, B stands for balance issues. Okay? E stands for eye problems like blurred vision, difficulty in seeing one half of the field. Okay? F stands for facial droop or asymmetry while smiling. Okay? A stands for arm drift or weakness. S stands for slug or speech difficulty in any form. And T stands for time to call emergency services. Key points. After a stroke, your brain cannot grow new cells to replace the damaged ones. Here, physiotherapy steps in. Okay? Now, physiotherapy can help to promote neuroplasticity. In essence, neuroplasticity refers to your brain's ability to reorganize, rewire itself by forming new connections between its nerve cells. Okay? Various techniques such as exercise prescription, skills training, manual therapy, or the use of electrical stimulation and other physical treatments to facilitate recovery also incorporated. Okay? Where applicable, a robotics guided therapy approach may also be used. Stroke key risk factors. There are multiple reasons you may be at a higher risk of having a stroke than someone else. Okay? The likelihood of a stroke is determined by a handful of factors, from increased age and diet to blood pressure, medical history, and family history, as stroke tends to run in the family. Okay? Can stroke be prevented? Yes, of course. Maintaining a healthy lifestyle, managing chronic conditions, and regular checkups significantly reduce your risk. Undergoing physiotherapy can potentially help you and your family regain strength, mobility, coordination, and balance. All right. For example, some programs I recommend for my stroke candidates include motor skill exercises. This help improve muscle strength and coordination throughout the body. These can include muscles used for balance, walking, and even swallowing. Okay? Another one is mobility training, teaching my patients how to learn to use mobility aids such as walker, cane, wheelchair, or ankle brace. Yeah, the ankle brace can stabilize this and strengthen ankle to help support body's weight while relearning to walk again. Okay? 3. Constraint-induced therapy. Yeah, an unaffected limb is restrained while you practice moving the affected limb to help improve its function. This therapy is sometimes called forced use therapy. All right. Another one is range of motion therapy. Certain exercises and treatments can ease muscle tension, known as spasticity, and help you regain range of motion. All right. Another one is technology assisted physical activities, which might include functional electrical stimulation. Here, electricity is applied to weaken muscles, causing them to contract. Okay, the electrical stimulation may help retrain your muscles. So, as a physiotherapist, what I usually do for my stroke patient is to assess their ability to perform daily activities by evaluating their muscle strength, balance, coordination, muscle tone, range of motion, sensation, and functional movement, including walking and transferring from lying to sitting or from one position to the other. All right. So the key areas I focus on as a physiotherapist include a range of factors after a stroke to understand my patient's needs and plan effective treatment are: 1. Mobility and function. Here I assess how well my patient can move their body and perform daily tasks such as standing and walking, moving from a bed to a chair, using the stairs, handling objects, amongst other things. Okay? 2. Balance testing. Yes, tests are conducted to see if my patients can maintain their balance while sitting and standing. Another one is coordination. 3. The ability to use different body parts smoothly and accurately is also evaluated here. All right. Another one is muscle strength. Okay. That is 4. I assess the strength of individual limbs and the grip strength, noting any significant differences between the sides of the body. 5 is muscle tone. I check for increased muscle tone, that is spasticity, which causes stiffness, or decreased tone, hypotonia, which can lead to weakness. Yes, very, very important. 6. Sensation testing. I check for my patient's ability to feel touch, temperature, and pressure, as well as their preperception, sense of position in space. 7. Range of motion. Measures how far joints can move passively or actively. All right. Another one is posture. Very, very important. So posture is observed to identify any imbalances or difficulties. Okay. Assessment process. The assessment process involves: 1. Health history. Gathering information about my patient's general health, medical history, and risk factors, time of onset, where, when, and how. Okay? 2. Medical review. Examining lab tests, X-rays, and other diagnostic images. 3. Hands-on assessment, performing specific tests for muscle strength, range of motion, balance, and sensation. Okay? 4 include functional observation, observing my patient performing functional movements and activities. Goal setting, very, very important. Number 5, working with my patient and the multidisciplinary team to set realistic and achievable recovery goals is also paramount here. All right, key points. After a stroke, your brain cannot grow new cells to replace the damaged ones. Note that. Here, physiotherapy steps in. So, physiotherapy can help to promote neuroplasticity. In essence, neuroplasticity refers to your brain's ability to reorganize or rewire itself by forming new connections between its nerve cells. Okay? Various techniques such as exercise prescription, skills training, manual therapy, or the use of electrical stimulation and other physical treatments to facilitate recovery are all incorporated. Without immediate treatment, brain cells begin to die within minutes. So recognizing the signs early and seeking prompt medical care can save lives and minimize long-term complications following stroke. Another key point, stroke is a major cause of death and disability worldwide. Okay, so every 40 seconds, a person suffers from stroke. Only very few percent of people with stroke get appropriate and timely treatment. This is largely due to lack of awareness. Okay? Now, time is brain, and every second lost is neurons lost. Hence, to avail maximum benefit, we need to identify signs of stroke. So you have to be very, very careful. Once you see those signs I mentioned earlier, call 911 or your healthcare provider for immediate care because stroke is an emergency. Note, if you or a loved one is at risk of stroke or experiencing symptoms, don't wait. Start your stroke recovery journey now. Send a direct DM. Share your thoughts. Every second counts. The faster you act, the better your chances of survival and recovery. Follow for more updates. Subscribe to my YouTube channel, Our Financial Clinic Programs. Once again, I remain your favorite online physiotherapist, Chinedu. Goodbye. Bye-bye.